Okay, so we've got our victim. We've got our victim. And let's turn you this way. Let's turn you this way so that people can see what a cute cat you are. Okay, so what you do is you take out the unit. Okay, so this is like a human inhaler, just normal human inhaler. Medicine's in here, the inhaler's here, this orange part, and a human would stick that in their mouth and spray the thing. But for a cat, we stick it inside this chamber here, and let me make sure that's focused. And when you spray the medicine, you push down once right here, firmly, and the medicine goes into this chamber. You don't really see it, although you can kind of see this white haze is the remnant of earlier doses. But you don't really see it, but it's in there. Look at this cat. Hilarious. Anyway, uh-oh, private time. Anyway, so you, it fills this area right here, and then the cat breathes in right here, and through this little valve mechanism here, you can count the breaths that he takes. And let me get a kind of a close look at that. Maybe I'm too close. There we go. So this little rounded green tab up here, that's actually how you measure the breaths, and it flaps down. It folds down like this with every inhalation that he does. So it's in its normal position now, but it'll go one for each breath, 2, 3, and what you want is 8 breaths according to our vet. So you want 8 times that flaps. Now sometimes he doesn't breathe fully in. It'll just go to like halfway or somewhere here, and it'll kind of flutter. It's because he's kind of doing this shallow breathing thing that he does sometimes. And in that case, I just count it as a half breath. So if he does a nice full one. If he does a 1.5, 1, 2, 3, 4, 5, and so forth. So you might get up to 10 kind of movements of this thing if he does a couple shallow breathing. But if he does good, nice full breaths, so it travels the full distance, then I just do 8. Anyway, a word about the mask. This mask part goes right on his face. Make sure that fur is touching all the way around. Sometimes, depending on the angle you're looking at it, his mouth might be kind of open out here, and then he's not getting full inhalation of the medicine, so he's missing out a little bit. So just make sure, just kind of take a quick look around, that all of this is covering his nose and mouth as much as possible. And one thing to be wary of is that sometimes if you're pressing too hard, you don't really need to press. Just put it on to where it's touching everywhere. Because if you press too hard, his nose can press up against inside here, and he can't breathe. So he'll start to panic if that happens. But just try not to do that. There's plenty of room for his nose if you're just creating kind of a nice basic seal around his nose and mouth. Anyway, so here's the procedure. You shake it up. You do a spray right here. You shake it up. You put it on his face. You do a spray so that he can immediately breathe in the medicine. And then you count in this little portion here. You count the 8 breaths, and then he's done. So let's bring in the victim. You ready, Chief? Okay, let's go ahead and medicines. Let's go ahead and medicines. Okay, and he's really good about this normally, so he doesn't have really any problem doing this. Yeah, see, he agrees. Okay, so let's move you back just a touch so that they can see better. Yeah, good idea. Good idea. Lean over this way so they can see better. Okay, let's see. Make sure you're in frame. Okay, good. Okay, so here's what we do. Here we are. We're shaking it. Can you see all this? Come back here. We shake it. Okay, we put it right on his mouth. Oh yeah, I like to hold his head. I kind of just hold it. Because sometimes he resists. He's not too bad. He's a good kid. But you just want to have a kind of pretty good hold of his head. And you not squeeze or anything. Just let him know that you're not going to let him get away or move. That he just needs to stay put. So, just give him just kind of hold him. Anyway, put it right on his mouth, nose and mouth, right there. Squeeze. Now watch the thing. There's a flutter, 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 full, full, full. He's kind of purring, so he's kind of different this time, but those are 9 flutters, 10 flutters, 13. And I'll stop right there. So he fluttered almost the entire time, which is totally rare for him. Normally he's kind of purring. He's purring because I'm petting him, giving him attention. But when he purrs, he does this kind of shallow purr breath, and they're just not really deep breaths that that would count fully as one. So you did a good job, buddy. You did a good job. Yep, you sure did. And I just try to reassure him afterward, so that it's always a nice, pleasant experience. That's probably why he does it so well, is because he always gets reassurance afterward. Anyway, and then that's it. You just put it back in the box. I just put it kind of on the other side of this other mask down in there, the bigger mask, which doesn't fit him. And then put it back wherever it was. So that's it. Thanks, Ranger, for being a good sport.